So there's three parts that make a tooth look good. There's the incisal edge, there's the gingiva, and then there's a bit in between. Now, when we look at the tooth, the first thing we see is the incisal edge. We see the frame of the tooth. So a tooth is like a rectangle with rounded corners, and we see that frame of the tooth first. So we see the incisal edge, and we see the shape of the gingiva. That is why kind of the holy trinity of dentistry is restorative dentistry, periodontal surgery, and periodontics, and orthodontics, putting the tooth in the right spot, having the gums in the right spot, and having the tooth in the right spot, and look nice. So that's the three things. So it's very difficult to do good restorative dentistry without good soft tissue grafting, without good soft tissue management. The soft tissue and the restorative go together. The soft tissue and the restorative and the orthodontics go together. So the introduction to soft tissue surgery really should be the free gingival graft and the sub-epithelial connective tissue graft. They are the workhorse of soft tissue surgery, and that is what I focus on with the soft tissue course. So Florin and I will be talking about a lot of the theory, a lot of the different techniques in the theoretical lecture section, and we'll be going over grafts that we won't teach you, but just so that you know the full range of grafts that are available, how soft tissue is used to prevent problems with implants. We know that the soft tissues around implants are probably more important than the bone in many cases, and how to get the soft tissue in the correct place for your restorative dentistry, for your implant cases. So that's a combination of grafting, crown lengthening, then the repair of problems that we get. The hands-on section, we will focus on these two really important things: the sub-epithelial connective tissue graft and the free gingival graft. Now, I used to try and teach too many types of grafts, and then you learnt nothing very well. So I've fine-tuned it. We're focused on these two, and we're going to do many, many exercises on those two grafts, so that when you finish, you will actually feel competent to go and do this on a patient, and you'll have a relatively high chance of doing a good job. Now, soft tissue grafting kind of sounds scary because it's not like anything else. Everything else you do in dentistry is a fixed target, it is a solid target, something that doesn't move, whereas soft tissue graft, its difference is that it's a mobile thing, okay? It's not like doing a filling where you've got a fixed tooth and you can cut it. This, you've got a loose object and you have to fix it into position using sutures, okay? That is the difference between soft tissue surgery and everything else, is that it's so suture dependent. So we will focus a lot on suturing techniques, on harvesting techniques, and then which cases, what you can actually expect to achieve, what's possible, what's realistic. You can't do everything that you want to with soft tissue grafting, and there's certain things that you can't get successful, and you should know before you start, is this going to be successful or not? The great thing about soft tissue grafting is, unlike many other types of surgery, if it goes wrong, it's very rare that you end up worse off than you were to start with. So many types of surgery, if they go wrong, you've actually caused a devastation, whereas soft tissue grafting, if it goes wrong, you often end up no worse than you were to start with. The free gingival graft is the most reliable and easiest of the grafts, and it's the one we use around implants, and it's used for all sorts of things. The sub-epithelial is the one that looks pretty, the SECTG, sub-epithelial connective tissue graft. Both of them are relatively straightforward. I've customised and made special models just for teaching this course, custom models. I'm the only one that uses the models that I have. I don't use pig's jaws. Because my patients don't generally look anything like pigs, I find using pig jaws for a lot of soft tissue grafting courses is not as useful as you would like. So we will mostly be working on my models, and you will learn the basics of suturing, harvesting, and when and where. Look forward to it.